Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. In this live streaming, we are going to talk about the preventive measures for common non-communicable diseases. We are going to look at common causes and risk factors for non-communicable diseases, complications and prevention of non-communicable diseases. So, without further ado, let's dive into it. So, introduction and the definition of non-communicable diseases. Non-communicable diseases are common chronic diseases that are not passed from person to person. That is what it means, non-communicable. You cannot get it from another person. You develop yourself. So the disease progress slowly, and they are usually influenced by lifestyle, genetics, and the environment. Usually we say that the genes trigger the gun, but the lifestyle and the environment pulls the trigger. That is what determines whether you are going to have the disease or not. There are people who have the genetic predisposition, but if your lifestyle does not agree with the circumstances to get the disease, then you do not get the illness. So the major types of non-communicable diseases include cardiovascular diseases. These are diseases that affect the heart and the blood vessels, usually the arteries. We have conditions like diabetes, type 1 and type 2. We have cancers of the various types. We have chronic respiratory diseases like asthma. Then we have common conditions like osteoarthritis. The common non-communicable diseases that happen and occur to individuals include cardiovascular diseases. These include conditions like heart failure, heart attacks. We also have strokes, very common. Then we have diabetes, as I've talked about, type 1 and type 2. Then we have cancers affecting the various organs in the body, like the lung, the breast, colorectal cancers. We have cervical cancer and all the other types of cancers, the blood cancers and the liver cancers. All these different types of cancer. Then we have chronic respiratory diseases. We have chronic obstructive airway diseases, highly associated with smoking and other conditions that cause blockage and the narrowing of the large airway systems, making breathing difficulty. Then we have asthma, which is an allergic condition. Individuals who have asthma, they are predisposed to hyperresponse of the immune mechanism, causing narrowing and the accumulation of excessive secretions in the airway. Then we have mental health disorders, are very common, like depression. We have conditions like anxiety. All these are non-communicable diseases. So let's look at some of the commonest risk factors and causes of these non-communicable diseases. When we look at the risk factors, we divide them into two main categories. We have those that are modifiable and those that are non-modifiable. When you talk about non-modifiable, you are talking about something that you can change. Because of what you do, you can stage the situation. The non-modifiable situations are things that you cannot do anything about. The non-modifiable factors include genetic conditions, your genetic makeup, you cannot do much about it. You have age, as you age, your risk for getting some of these non-communicable diseases increase. Then you have gender, being male or female, increases your chances of getting some of these conditions. You find that there are some conditions that are less, like heart attack, they are less in ladies below menopause, but after menopause, then you realize that they also catch up with these diseases. Then we have lifestyle factors, which these are the things that you can modify, like an unhealthy diet. You can always have a lot to do with what you do. Physical inactivity, you decide whether to live sedentary lifestyle or to be very active in your life. Then is a choice to smoke or not to smoke. Use of alcohol and how much to use is something that you can also decide on. We have environmental factors. These are things that are within our environment that also have an influence on whether we get a particular disease or not. And they include things like air pollution. We have occupational hazard. These are things that predispose you to diseases because of where you work. And then where you live. We have being in a rural community or being in an urban center. And you find that people who are in urban centers, they are more predisposed to some particular conditions. And as people move from rural areas to urban centers, then their risk of some particular diseases changes. We also find that also migration, if you migrate from one country to another, your disease predisposition will tend to be influenced by. So these are the common risk factors and causes. We have seen they can be modifiable, non-modifiable, they can be within you and without the environment that you live in. And these all affect whether you get the diseases. Then we have some of the commonest complications, and these are the things that lead to someone using the healthcare or someone dying from these or getting complications of these diseases. We have cardiovascular diseases, as I've said. These are diseases that affect the heart and the blood vessels, and they include conditions like stroke. We have conditions like heart failure. We have various complications of blood vessel diseases. Where when we are talking about blood vessel diseases, we are talking about those diseases that develop as a result of the blood vessel narrowing, a condition that we call atherosclerosis. And because of this, you can have coronary artery. Coronary arteries are the arteries that supply blood supply to the heart. And because of the narrowing, you may have a condition which we call angina, which is pain from the heart. You may have coronary artery syndromes. So this is whereby there is in and out narrowing of the blood vessels supplying the heart. You may have a complete blockage of these vessels, leading to a heart attack, and this can severely compromise your heart functioning and can even lead to death. Then we also have strokes. These are conditions that are associated with the blockage of the blood supply to the brain, and this can be either transient ischemic attacks, or the strokes can be what we call infarctive. There is a complete blockage, or there can be hemorrhagic. There is an opening and a burst of blood vessel with blood pouring into the brain. Transient ischemic attacks, which I've talked about in some of the previous videos, are like warning signs that you can easily prevent yourself from getting a stroke if you take the necessary precautions. If you need more information on how to go about this, you can check some of my previous videos on how to prevent a stroke from happening. This you can get from the Overall Health channel. Then we have diseases like diabetes, which will lead to complications like blindness due to the effect. Diabetes affects the eyes in various ways. You can have arteries that supply blood to the eyes blockage, a condition that will lead to hemorrhage in the eye, and then you can have the back part of the eye that is responsible for transmitting images to the brain is compromised or detached, and this can lead to blindness. Then you have diabetes can also affect your kidneys, and usually starts in a slow progressive way with loss of proteins in urine, and this can be detected early if you have a regular checkup on how your kidneys are functioning, and if you have a regular health checkup of your kidneys by your health provider. Then you have neuropathy. Neuropathy is the effect of diseases on nerves, and this will present with the burning sensations, and people will complain that they feel like their feet are getting very cold, excessively cold. They can also become very sensitive, and they can also become, you feel like they are burning, and you are not even able to step. And then sometimes you can lose sensation, and this could be life threatening, because it predisposes to injuries to these people, because there's no sensation. And so someone can put his foot in a hot object, or even put the foot on fire, and he will not feel it. And this has led to people getting scalded by hot water, or even getting pricked or injured by object without realizing it. And then later in the disease, you realize that actually your foot was injured. So these are some of the complications of diabetes. And of course, with the diabetic foot, with the infections, dead feet, or seriously infected foot, then you can have amputation. Amputation is whereby part of your foot, either the toes, the foot, or any all of the lower part of your foot below the knees is removed. You can also have above knee removal of your foot, depending on the part that is affected. Then we have cancers. Cancers present in various ways. They have various complications, which include one, the local effects on the cancer. You can have the local effect of pressure from the cancer. You can have bleeding at the site of the cancer, and you can also damage to tissues at the cancer, and this can lead to organ failure, and also it will also lead to suppression of your immune system. And of course, cancer moves from the primary site, and they move to other organs, and this will have complications to the site where the cancer has moved. You can have bleeding, you can have a compromise of the organ that is the cancer has moved to. And usually cancers move from the original organ. They can move to the lungs, they can move to the liver, they can move to the bones, leading to breakages of the bones, and they can move to the brain. And if the cancer moves to the brain, then you may have conversions. These are epileptic-like reactions due to the effect of the cancer in the brain. So these are some of the common complications of cancers. Then you have chronic respiratory diseases, which when you get conditions like emphysema, then you may have a serious damage to your lung tissue, and it affects its expansion. You can also have obstructive airway diseases, whereby the major big airways are not able to open up and allow air in or out, and this leads to serious compromise of your breathing, and this can lead to failure in your breathing, and this can also lead to death or even serious disabilities. You have individuals who have used their cigarette for long periods, and then they end up getting respiratory failure, and they are dependent on oxygen due to chronic obstructive airway diseases. So these are some of the complications of the non-communicable diseases. And the good news is that there is always hope, and this can be prevented or even reversed, depending on how willing you are to change your lifestyle. So what are some of the things that you can be able to do as an individual if you have these chronic diseases, to reverse them, or to slow the progress, or if you don't have them, what can you do to prevent yourself from getting these non-communicable diseases? Because aging, you must age. Your genetics you cannot change, and being male or female you cannot change. I know there is the issues of gender change, but that does not change your risk to the diseases. It only brings you the complications of the hormones that you are using. So one is diet, and when we talk about a healthy diet, we are talking of a diet that has high fruit, vegetable intake, high intake of fruits, intake of whole grains more than the refined grains, and the use of less of the processed foods, and the use of the less proteins. And some people, actually, there is some thought that diabetes is a disease of carbohydrate toxicity. This is an idea that is still in the development in the development. And if you reduce your carbohydrate intake, you are likely to reduce your chances of getting the, overweight, and also reducing the complication of excess insulin, which comes as a bout of insulin, leading to insulin resistance. Then we talk about regular exercises. Then we talk about doing moderate to intense exercises for about 150 minutes to 300 minutes in a week. And this, you can divide it in the along the week, or you can have intense exercises of about 75 minutes per week, depending on how your schedule is. As I say, your exercise program should try to fit you as a glove. It's not too tight and it's not too loose. So that if it is too loose, then most of the days you are not doing it, and it's not too tight that it incapacitates you. You should have the flexibility so that you can be able to fit your exercises into your daily routines and be part of your life. The thing is, it is not how much you are doing, but the consistency. We talk about these small actions, but consistently done over time. Because even to get these non-communicable diseases, it is not because you take a heavy meal today or you take excessive sugar today. It is the consistent intake of the wrong diet, consistent inactivity that brings you the complications and the to the point whereby you get to where you are and now incapacitated, or you have the disease. And the health is also the same. It is remember that health is not a destination, it is a journey where you develop these small activities and then you develop them over time. Then avoid prolonged sitting and maintain a healthy weight. Always keep looking at your scales. At least every month you should have a check on your weight to see how you are doing, and then adjust your diet accordingly. Then there are some habits that are harmful to us and they cause us to get diseases. One of them smoking. If you're a smoker, it is very necessary you do all it takes. Look for counseling, look for apps that can help you to quit, look for alternatives to smoking, go for rehabilitation so that you can stop smoking and completely quit it. There is, stopping slowly is a thing, but then making the decision to quit is the most important thing that you can make for your life, and the best gift you can give to your body. And of course, if you have not started smoking, I encourage you not, especially the young people, not to start. And we also create an environment in our society where young people are not encouraged to get into drugs, to get into alcohol, because excessive intake of alcohol also has its own risk. So it is important to reduce cigarette smoking, because by doing so you reduce your risk of getting heart diseases, you reduce your risk of getting stroke, you reduce your risk of getting cancer. And it is sad that 70%, almost up to 85% of the people who get lung cancer, the biggest risk is smoking. If you want to learn more about some of the risk factors for the various cancers, you can always check in the overall health channel. We have talked about the various cancers and the risk factors. Then limiting alcohol intake. If you reduce your alcohol intake, we say that for men, don't go for more than 2 drinks, and for ladies 1 drink is adequate. And it doesn't matter which alcohol type you are taking. If it is the spirit, don't take more than 1 tot. If it is wines, don't go for 1 glass, more than 1 glass if you are a lady. For men, not more than 2 glasses. And for beers, not more than 2 bottles for men and less than 1 bottle for ladies. This will help you reduce your risk of liver diseases, reduce your risk of cancer, and also reduce the risk of getting some of the complications of alcohol on the heart. The biggest being what we call alcoholic cardiomyopathy. This is a disease that affects your heart muscle, and it makes the muscle enlarged and stiff, and it makes it incapable of pumping blood adequately as it should. Then other ways of preventing these non-communicable diseases is having regular health checkup. I encourage you that as much as possible, you have a consistent healthcare provider who knows you very well, has a good history of your illness, and can advise you on the checkups that are appropriate for you and for your age. And if you want checkups also, you can check with us at Wellness Health Services, and you can automatically book yourself through our website, the Wellness Health Services website, or you can give us a direct call on the number on the screen or the number in the Wellness Health Services website. You can also directly book and ask questions or contact us through our website, the Wellness Health Services website. So another thing that is important is blood pressure monitoring. This you can do to your convenience. And these days people have the blood pressure monitoring machines. What I would say about self monitoring of the blood pressure, make sure that you are doing it the right way. I have explained in one of my previous videos on how to do the blood pressure the right way. Please check it over in the overall health channel. And if you have not subscribed to the Wellness Health Services channel, please do so, so that you can be also be informed when we release new content about maintaining your health. Then cancer screening. Common cancers that can be screened for. We have cancers like cervical cancer, which you can screen if you are less than 50 years with a VIA. This is visual inspection of the cervix. And the glucose iodine is applied to the cervix, and the health provider is able to look and tell you whether are your cells normal, do they show any abnormal cells, and this can be done. You get the result immediately. It takes less than 10 minutes, actually even about 5 minutes, and you know what is your cervical cancer situation. And you can also do a human papilloma virus test, and if you are negative for human papilloma virus, then you can do the cervical cancer screening every 5 years, unless you are HIV positive. If you are HIV positive, then we advise that you do it every 2 years, because HIV increases your risk of getting cervical cancer. Then you have the mammograms, and before you come to the mammogram, you have the self-awareness of your breast. This is what ladies do, and I encourage them to do every month. Even men should do it, because men also get breast cancer, though the percentage of men who get breast cancer is about 1%. But for ladies, almost 95% of the breast cancers happen in the ladies. And just going through your breast on a monthly basis, I have put posters in my social media channels on how to do self-breast examination. Please check them up and do it for yourself, and usually encourage you that you do it after the periods when your breasts are not very sensitive, and they get to know your breastfeeding, because sometimes the lumpiness can be confusing. But if you are doing it on a daily basis, on a monthly basis, you'll be able to tell abnormal from the normal. So that is very important. And of course, after the age of 45, we encourage that you go for mammograms. Below that, then it is important to do what we call ultrasound if you feel anything abnormal in the breast. The good news is that I do not know whether mammograms help detect cancer in its early stages, and it also help delineate the consistency of your breast. And if there is any abnormality, you can always go for checkup and have a surgeon or a medical provider check further on you. Then we have colonoscopies. This we encourage people who are beyond the age of 45 to have at least a colonoscopy every 10 years. Colonoscopy check for cancers of the colon, which are also a major cause of death and the morbidity. Morbidity is the use of health care because of colon cancer. Then, of course, I talked about VIA, and then you also have pap smears, which you can do also every 5 years. They are simple to do. You get the results possibly after a week because of the processing time, but they help you remove any anxiety that you may have about your cervix. Then another common test that you should always do is checking your blood sugar to know how your blood sugar is doing, and if you have any abnormal reading, then the health provider will advise you on what to do. Then also checking and having your body mass index checked so that you know how is your body weight, and also checking on your lipid profile or your cholesterol level, because high cholesterol also increase your risk and increase your 10-year risk of getting heart diseases, the cardiovascular diseases, and also high weight and the high is also associated. Many of the risk factors that are associated with the pancreatic cancer, you look at colon cancer, you look at breast cancer, they are associated with the being obese. So obesity is something that you should need to be aware about and do everything that is within your capacity to overcome it. So it is important that you struggle very hard to maintain your ideal weight. Remember, this is a journey. As I say, health is not a destination. It is a journey. So don't be over preoccupied that I have not lost weight. But what measures have you put in place? You are looking at your diet, you are looking at your activity levels, you are looking at how much sleep you are getting. All these things are very important. Then other issues that are important in maintaining and preventing yourself from getting these non-communicable diseases is mental health and stress management. When you're talking about mental health, how do you maintain good mental health? The first thing that you need is adequate uninterrupted sleep. We are talking about 7 to 9 hours of adequate sleep, and how you attain this is having regular sleeping time, avoiding distraction before going to sleep, and also practicing mindfulness, relaxation, meditation, and also relaxation techniques like yoga would help you cope up with stress. And if you feel the stress is overwhelming you, then it is always important that you don't take it on yourself. Remember that looking for help is not a sign of weakness, but is a sign of strength when you realize that you cannot make it on yourself and you go for assistance from another person who is well versed with mental health issues. Then building good social connections. Remember that health is a village issue, and having good social connections. When you are overwhelmed with things, you have someone to share with. People whom also you can be able to share your health journey with, who will be concerned about your health, and they help you and they encourage you to live a healthy life. This is very important, and it will help you improve your health. So these are some of the things that you can do as an individual to improve your health and prevent yourself from getting these non-communicable diseases. And if you have already gotten the communicable diseases like hypertension, diabetes, you are obese, you have depression, or you have these common chronic pulmonary diseases like asthma, bronchitis, then changing your lifestyle can help you reduce the complications, reduce the use of the healthcare, and live a better life, and live a life that is fulfilling, whereby you can achieve your dreams and meet your goals in life. So then we have things that we can do as a society. Health is not an individual undertaking alone. It is what we do as a society that also has an influence of our health. Government regulations like regulation of tobacco use, alcohol, and the food industries. And that's why you see government coming with policies about no advertisement for cigarettes, having specific designated smoking areas, restricting smoking for people who are underage, restricting selling of alcohol to people who are less than 18 years, and the other measures like preventing these drinking places in where communities are, because sometimes having pubs in the midst of near schools, in the midst of estates, encourages people to take more, encourages young people to drink more. And of course also Helping young people. Now there is a concern, especially like in our country, of young people getting hopelessness because of lack of employment, also having a lot of influence from peers on use of drugs, use of alcohol. All these are things that we should be able to handle as a society and help our young people to develop activities like engaging them in sport, developing sport as a way of helping young people to have alternatives and they feeling engaged so that they don't take up into use of drugs. So also control of the food industries, knowing what are the components of the food that we are using, and also regulating what is put in the food that is sold, and making sure that the food we eat is healthy. Then creating public health awareness. We always have the month of February is dedicated to heart health, and you'll find many issues going around heart health. The month of March is a month dedicated to ladies' health and also to kidney health. And so this month of March, let's do things. We encourage ladies to go for screening for pap smears. We encourage them to go for mammograms. Encourage them to do more of self-breast examinations, and anything that we can do as a society to help the ladies within our circles live a better life and reduce the emotional stress of illness. And then also, what can you do to improve your heart health? How is your diet? What are you doing to prevent yourself from getting diabetes? Are you exercising to maintain your weight within the normal limits? Then you have school and work wellness programs, where you have places where people work that they are encouraged to keep healthy, and we have programs that encourage people to exercise, to eat healthy, and even schools where you have health talks for students, encouraging them to wash hands, avoid risky sexual behaviors, and also be able to avoid drugs. So then in conclusion, non-communicable diseases are a major global health issue, with causing a major burden on the healthcare system, and also being a major cause of death and disability in individuals. And lifestyle modification and regular checkups are key to preventing these non-communicable diseases. And then let us remember that collective effort is needed from individuals, the healthcare providers, and the government. And that way we will be able to keep our society, we will keep individuals healthy, and we will be able to have a better future for all of us. And they also don't forget that we need to take also care of the environment. Planting more trees, making sure that we use the public transport system more, so that we reduce the carbon emissions, proper disposal of waste. Remember that climate change is a major issue in our health. And so in some of my talks upcoming, I have talked about the impact of climate change on our health, and you should be in a position to subscribe and also follow us on the overall health channel. We also have the Wellness Health Services website. You can directly message us, or you can even book consultations through our website. And you can also follow us on the social media links. I have a newsletter which is dedicated to helping you improve your health on a weekly basis. And we have a blog attached to the Wellness Health Services website. So thank you very much for watching, and thank you for being with me for this live stream. I will come now open discussions. If you have any questions, I will be able to take a number of them, so that we also interact more. You can also continue sending your questions. You have also your comments about what is your understanding, what are the challenges that you are facing in being able to fight these non-communicable diseases, and if you have a group or a society, what are you doing? This time round we are talking about universal health care coverage. We have the community health workers who are with us. How are we assisting them? So that they monitor our blood pressure, they monitor our blood sugar, they teach us some of the things that we can do to improve our health. Do you have a social group where you interact and talk about health? And also, do you have a consistent healthcare provider who should be your guide or your coach in your health issues, so that he can remind you when you need to have your screening and what you need to do? Remember also, we are talking about technology, and now people are using more of the wearable devices. There are so many apps in our phones that can help us track our exercises, also track our blood pressure, track our heart rate. And when you see your heart rate is changing, then that could be the trigger or the tweak that tells you that something is not all right. So thank you very much. I'm looking forward to more interactions and questions or even comments on what we need to do or what you are doing to improve your overall health. Thank you. So any question, comments that we have? So remember that wellness is a personal journey, and if you have not been able to follow this live stream, you can also view it in the wellness, the overall health channel. And please, when you do, leave your comments, leave your concerns, and also share what you are doing to improve your health, so that together we can encourage each other in our health journey. Thank you very much, and keep healthy.